All right, so thank you guys for coming tonight. Again, my name is Dawn Coley, and today we're going to be talking about caring for a hospice patient. So as you know, as new grads, we are definitely not taught how to care for hospice patients. So now as new nurses, if we have to go into a patient's room that's a hospice patient, it's pretty intimidating. So this presentation is going to help you learn, hopefully you'll learn how to communicate with hospice patients and their families, and how to incorporate self-care when caring for a dying patient. All right, so our objectives are explain what is hospice care, discuss communication techniques when talking with a hospice patient and their family. We're going to show a demonstration of therapeutic communication and discuss ways to protect yourself and provide self-care while caring for a dying patient. So first of all, what do you guys think hospice care is?
End of life.
Yeah, when a patient's dying, it's like the end, kind of last resort stuff.
Or also too, isn't it like they have a life expectancy of less than 6 months is when you can go on hospice? And I met someone once who graduated hospice because they live longer than 6 months.
I think you have to renew, I don't know what it is, renew your hospice care or contract, or I don't know what, after 6 months if you're still living, right?
Yep, and people can go on and off hospice care just because of that. You're absolutely right. They can all of a sudden like get better and they might be off a hospice care. So according to the American Cancer Society, they consider hospice care that focuses on the quality of life for people who are experiencing an advanced life-limiting illness and care for their caregivers. Just like you said, April, it's a patient's life expectancy is less than 6 months. It's to provide compassionate care for the patient to live as fully and comfortably as possible. We treat the symptoms of the disease, but not the disease. We specifically attend to their emotional and spiritual needs, and we prioritize comfort and quality of care by reducing their pain and suffering. So in nursing school, we learn how to discharge patients. We learn how to talk to them about medications. We even talk to our friends and so forth about their birth plan or about surgery. But how many times have we talked to a patient about dying or death? It's kind of intimidating, right? Even amongst your family, a lot of times you don't talk about death. So it's really important for us to learn how to communicate with patients that are dying and with their family members. So I don't know if you guys remember from school, therapeutic communication, right? Therapeutic communication is not just communicating one-on-one. It's not just, people just sharing information. It's actually focusing on the patient's learning and their growth. The goal is to actually facilitate patient expression, assist them with their problem solving, and provide insight to what the patient's priorities are. So do you guys remember any therapeutic communication techniques that we learned in school?
Don't ask why.
Don't ask why. I like that. Anything
Open-ended.
else?
Open-ended questions.
Yeah.
Depends.
Yeah, I think it was like being present, like don't necessarily talk, but be willing to just be present and listen.
Great. That's exactly it. I know I'm quizzing you guys and you're out of school. That's really not fair, is it? So according to the Journal of Oncology Nursing, they actually came up with some therapeutic communication ideas for hospice patients. So first we want to establish the relationship. So we want to encourage patients to ask questions. Just like April said, we want to use open-ended questions, and we want to ensure privacy and comfort. We also need to develop an understanding with the patient and family, a shared understanding. So we want to check for understanding, not only for our patients are understanding, but to make sure that we are understanding our patients as well and what they want. Discuss expectations, and as Anne said, actively listen. You need to actively listen to your patient. We also need to support our patients and families by addressing any cultural needs, consider spiritual and religious needs, and avoid jargon or euphemisms. A good euphemism is like, they passed away. Well, in some cultures, they might not understand what passed away means. So we need to be more direct in saying the patient died, and not using terms that they might not understand. We also need to respond empathetically. So even touching the patient or sitting next to the patient or praying with a patient, even silence, right? I think that's so hard for us Americans, especially me. You know, when I'm with a patient or when I'm with somebody, it's hard to be silent sometimes, but that's what they need sometimes. And then also to close the conversation, we need to summarize and emphasize our goals and check for understanding. So role playing. So I actually found a video. I was actually going to do this with you guys, but it's so hard on Zoom, and I know with everything going on in your guys' life, I found this great video. So I'm going to share this right now, a YouTube video. So just 1 second. All right. Do you guys see a different screen now?
Yes.
Okay, great. I'm just going to play this. It's only like a minute long. You guys see that?
Mm-hmm. Can you put the subtitles on? Because I can't hear anything.
Oh, you can't hear anything?
It might just be because of my phone. I don't know.
Can you
No, I
hear something, Anne?
No, I can't hear the audio.
Okay, just 1 second. Let me try this again. Sorry.
I mean, I can read.
Yeah, we can read it.
Let me try one more time. My husband and I worked through this to try to figure out how to do it.
There's a little rain outside.
Just 1 second. I'm going to go back to this one. Do you see the presentation again?
Yeah.
Yes.
All right, just 1 second. And you see the video blank screen?
Yes.
Yes. Yep. Oh, there you go.
Hi, I'm Elsa. I'm gonna be your nurse. How are you feeling today?
Thank you for asking, but to be honest, I don't know. I feel angry, I feel worried, I feel a lot of emotions. I don't even know how to put it out, to be honest.
Well, I'm here to help, so if you want to talk about it, I can listen to you.
That's a good idea, actually, to be honest. Why don't you sit down? Let's talk about it. So, I have a lot of concerns, but the most is I'm dying. And it's really real. I mean, the clock's ticking down on me. I have a daughter, Annie, and I'm worried for her. Like, I don't know what to do. Like, what's gonna happen to her? The thing is, my wife also passed away, and like, she's been the only child, and it's been so tough on her. And now me passing away, I don't know if she'll come out of it. You know, I don't know how her teenage years are gonna go, how her life is gonna end up being. I don't know if David, my brother, if he's gonna accept her, if he's gonna take her home. I have a lot of concerns. I don't even know the financial situation right now. Everything just seems too real and overwhelming.
Yeah, I understand. Dying can be really scary, but I really appreciate you sharing this information with me. It's a real strength of yours. And if you want, I could talk with your daughter and your brother to see what they think about it, and we could discuss it after.
I think that would be really generous. I don't know. I guess we'll just see. We'll see what happens.
All right. So what do you guys think? What kind of therapeutic communication skills did she use during that interaction?
Touch
Yeah.
when appropriate.
Yeah, perfect.
She listened. She didn't interrupt or put in her own story or anything. She was quiet the entire time. And then afterwards, like, thanked him for sharing his thoughts with her
Yeah,
and offered not a solution, but to help facilitate
Opening up that
concerns.
conversation with his brother and daughter.
yeah, yeah.
I like how she positioned herself side by side, shoulder to shoulder. I think that's really important. And sitting down, I just learned that this week. Like, that's a really effective technique. So the patient doesn't feel like you're in a power position, but you're literally just focused on them one-on-one, like when you sit.
That's great. You guys actually came up with all the things that I found as well. So good job. Great job. All right. So now that we've had this conversation with this patient, it's exhausting, right? Like we literally are just burnt out from caring, talking with this patient, kind of taking on their feelings and emotions. So we need to provide self-care. Nursing is a stressful job as it is. So how do you guys take care of yourself?
Pedicures.
What
Wait,
is
what'd you say?
How do you guys take care of yourself?
Pedicures, I said. I treat myself
Pedicures,
to
like,
pedicures. Also boundaries. I feel like I I try my best to keep my empathy and compassion because I don't want to be like a robot, but I also make sure that I put up boundaries and I don't allow myself to get too intertwined because there's a lot of emotion and families and a lot going on within nursing. And if you took on every family's grief like your own, then it's too much. So boundaries, I feel like, are another thing.
that's great.
I'm taking a managing stress, like rest and relaxation course, and I did not expect to get as much out of it as I'm getting out of it. But it's mindfulness and meditation are the two things I'm really focused on, like staying in the moment, and being mindful and grateful and thankful. But then meditation at the end of like the day, especially before I try and go to sleep or even interact with my family. When I get home, I'll sit in the car and just breathe and just try and release some of like everything I'm bringing home with me from the day and just try to like calm down.
That's great. And Jessica, didn't you just say today you texted about doing chair yoga?
Yeah, so I think I've been participating more in like what my mother-in-law offers. She does a lot of like self-care things. So one of the Zoom classes today was chair yoga. So just, I guess, participating on these self-care things, are helping, something that I back then wouldn't go out of my way to do.
That's great. Yeah, as nurses, we need to take care of ourselves in order to be able to take care of our patient, right? And I think the biggest thing is, I kind of think April hit on it, but we need to realize that there's going to be a lot of stressful situations, but we need to allow time to cope. So even if that's walking away from the floor for a few minutes, just taking a breather, because we can't take on all that stress. Exercise, yoga, adequate sleep. Not that we get adequate sleep all the time, but we need to try. Stay hydrated, especially being on the floor for 12 and a half plus hours. We need to make sure we're eating healthy and staying hydrated, and having good friends like you guys, or a mentor to talk to tell each other our frustrations.
I was gonna say that last bullet point, like I have called you, Dawn, I have called Anne, I feel like it's really nice, the profession of nursing, everyone around you, even if you're in different populations, kind of understand what you're going through.
Yeah.
So caring, it's like something nursing school didn't realize they did for us, but like kind of giving us
A support group.
a support group basically for all the new grad struggles and whatever we, may go through.
And hopefully we'll keep that friendship forever and be able to just laugh about these other times when other things come up, right?
Yeah.
Right. In
For
a year, we'll be laughing at us for
And
being
like,
little new grads.
So for like example, April starting first before us and kind of giving us a guideline of how things are, and then Anne preparing for that, and now Anne going through this, and now Dawn starting, and then eventually me starting. It's like, okay, I in a way know what to expect, what feelings I'm gonna feel, and reach out to you guys.
Yeah, great. Well, so how do you guys feel about caring for a hospice patient after this presentation? Do you feel a little bit more comfortable, or kind of have some ideas of how to approach it?
I do,
feel like
for sure. It was a great reminder And then it was a great visual, just listening to that, the clip that you played, just things that are important, fears, things that I'm kind of removed from right now. And yeah, it was definitely a really good reminder. So I would say yes, I would feel a lot more confident now.
Great. And
I feel like
you guys are doing a great job at self-care as well, I think. So I think you guys you could teach a class on that.
We've got that down.
What were you
I
gonna say,
feel,
April?
I was saying I feel like that video really like one, it makes you think, but two, like I've had multiple hospice patients before, and like I only had one that was like young, like she was like maybe 50, and like I helped like give her like a wipe down bath, and like I'm used to my hospice people, they were like they died the next morning, like they weren't talking, they were like actively in their stages, and I never had an actual, she was like a walkie-talkie patient, like you would have no idea.
Dying. Yeah.
Yeah, and like the just being quiet, like I remember she was talking about, like she started crying, and I was in there with her sister-in-law, and she was just talking about how like she wasn't able to be intimate like with her husband ever again. And in that moment I was like, this is real. This is, and I was a tech at the time, not a nurse, but I feel like that video, like it shows you that, maybe in your head, your problem is, oh, I have to talk to this person. But the person's problem is they're dying. So like it just, I feel like that was a really good visual, and something like we should have done that in school. I feel like that is something that should have been taught,
Totally
like a
agree.
sim day.
I
So
think so, also like an eye opener where it's not that like what's looming through their head is not only, oh, I'm going to die, it's also like all these problems that they're leaving behind and they're concerned about it. So
yeah.
There's other conversations that you're able to have with them where it's not just about talking about their looming death, and helping them with other situations.
As you said, they might be okay with dying. They've accepted that part of it, but it's everything else. It's their family. Who's going to do this? Who's going to do that? Yeah, definitely. So the key thing is also remember we have our preceptors, our charge nurses, our colleagues, our clinical mentors, our educators to go to if we have questions, or if we are concerned, or if we don't know how to approach a patient. So reach out to them if you have questions. So now I know this is you don't like assessments or tests, but this is not a true test. It's mainly for myself to make sure that I cover the information appropriately. So if you guys could just go through the questions and then just text me the answers. You can just do 1, true or false, 2, A, B, C, or D, and then 3 and 4 is just fill in the blank. If you could just text me those answers, that would be great. But do you guys have any questions at all or concerns or?
No, I think it was great, and it was necessary. And I think that even just bringing up the conversation is like, I feel like it helps you kind of just feel like sit on your own thoughts with death, and kind of visualize in your head, like, what would I do if I was in this scenario? And, you know,
Yeah.
realize that a lot of times maybe people aren't looking for answers. They're looking as for like support, which, you're there as their nurse. So
Yeah.
I think it was great.
Thank
I
you
do
guys.
too. I agree.
Thank you guys so much. I'm going to stop sharing.
Wait.
Okay, go ahead. Oh, yeah. I'm going to stop sharing, but, oh, wait, never mind. You're okay. I'm going to stop recording. How's that sound?